Good morning. Thank you. It's good to see so many people here. And before I introduce our keynote speaker, I just wanted to outline broadly the shape of this session. I will introduce Åsa and stop getting tangled up in things, and then give her the floor. And we'll have about half an hour at the end for questions and discussion. And as you know, the questions and discussion are a really important part of the EARLI conference. This dialogue is what it's all about. So I'm flagging it now so that you can start to think of your questions so that we have too many people volunteering to ask questions and not a silent floor. So there's your advance warning. And as someone who was once a teacher, be warned. I'm very good at getting people to answer. So we'll take it from there. So with no further ado, and to allow maximum time, I'm really delighted to introduce Professor Åsa Mäkitalo, who's Assistant Head of the Department of Education, Communication and Learning at the University of Gothenburg. She's trained in human resources and organizational studies and earned her Ph.D. in 2002. And since then, she's built a distinguished career exploring how institutions communicate, learn, adapt in a changing world. Åsa has played a leading role in major research initiatives, including co-directing the Linnaeus Centre for Research on Learning, Interaction and Mediated Communication and founding the LET Studio, a transdisciplinary network studying how technologies reshape knowledge and participation. Her research illuminates particularly how expertise is transformed through technology, how knowledge is collectively negotiated and co-produced, and how participation in institutional life is organized and made accountable. Her current projects address digital citizenship, welfare, and professional trust in an era of autonomous systems. So we're really pleased, Åsa, that you've accepted the invitation to give this keynote, and we're all very much looking forward to what you have to say. The floor is yours.
Well, as I have prepared reading my talk today to stay very focused, I will do that. So please just think about what you would like to dialogue with me on later on. I would like to thank you for the introduction and for the invitation. And I would like to comment first on my long-standing relation with this community from my first PhD poster at the 9th Biennial EARLI conference in Fribourg in Switzerland. That was in 2001. And the EARLI community has always been characterized by openness and curiosity across very different lines of research. And this is something I truly appreciate. Many early researchers and networks have taken a part in our Gothenburg research activities over the last 20 years or so. And since the pandemic, I have had the pleasure of working more closely with the Headwork Research Group at Oslo University, who I still work with. So as the literary scholar and, so as the literary meta-theorist Bakhtin would say, the word is half someone else's. A keynote at EARLI is no exception. In my talk, I will draw on insights and ideas collected over many years of conversations around book projects, seminars, research proposals, and joint research efforts. It's truly a collective effort, but I'm accountable for the presentation here today, of course. The title of my talk is Ways with Worlds, Approaching the Dynamics of Knowing and Learning as Situated Practices. Under this heading, I will thematize how current digital transformations challenge established ways of knowing and learning. I will share some entry points and ways to approach such dynamics as a researcher. By the end of my talk, I will elaborate on some analytical notions I find relevant for future studies. So let's begin. As you can see from my outline, I will first frame my talk with some points of departure to make sure we are as aligned as possible as we start off this journey. So I will address the basic premises and the relevance of studying knowing and learning as situated practices. Secondly, I will highlight the importance of how we analytically formulate a relevant context where knowing and learning is at stake. I call this part Ways with Worlds, and here I will exemplify how we have formulated problems to investigate. Third, I will give some glimpses of current empirical work and comment on the ongoing dynamics of change. I will then summarize some insights and formulate emerging questions and highlight some analytical notions I'm currently working with, which I think are fruitful for future studies. So why study the dynamics of knowing and learning as situated practices? Well, because what is relevant to know and learn in a society changes over the course of history. It is situated in time and place, and thus our research accounts of what it means to know and learn must take this into account. Many current challenges emerge from attempts to redesign institutional practices and reshape societal relations. What we need are some robust and generic conceptual means and ways of approaching such practices that helps us analyze institutional change over the course of time. So my main question is how established forms of knowing and learning are challenged in digital transformation. And in this perspective, learning becomes the locus of cultural change. So in this kind of study, like all kinds of studies, there are some problems we need to seriously attend to. And I think that Lena Yayusi pinpoints them well. So I will use her as a main reference, and her work has long been a source of inspiration for me. Analytically, she asks, what is this phenomenon? How does one conceptualize, locate, and individuate practical activities and courses of practical interaction? What specific sorts of activities provide a focus for the understanding of other sorts of activities? And of course, following this methodologically, how is access to such activities achieved? By what steps can an analysis proceed? And what counts as warrantable analytic inference? The study of practical activities can be broadly located within the study of communicative interaction. So the initial focus of analytical interest are the members' activities of describing, inferring, and judging. These activities between action and expectation in everyday life are pervasive in the conduct of work. Indeed, they seem to be constitutive of diverse social practices and domains of social life. As an example, I took this utterance from a rehabilitation ward delivered by a nurse on the new shift to a nurse leaving. This utterance is clearly delivered. Oh, maybe I should read it. How is the femur fracture on 2-3 doing? This utterance is clearly delivered by the nurse in the course of practical activity, informing herself through interaction. What is taken for granted, known, is displayed through the use of a medical classification, a femur fracture, but also the specific location at the ward, room 2, and the 3rd bed from the left-hand side. But her utterance also displays an expectation of the nurse leaving to report on the condition of the and be knowledgeable about the patient. If there is a gap here between action and expectation, someone has some explaining to do to clarify the situation. In this context, the diagnostic category is activity-bound. A set of institutional activities are expected to be pursued, and different professionals have different sets of category-tied entitlements and obligations in relation to this case. Knowing how to categorize and proceed with a case is salient in any professional activity. Institutional practices are designed to stabilize and coordinate our perceptions and actions collectively. It is the social organization of work. And what we know is embedded in the social material practices in which we engage. So studies of knowing as part of practical activities in a specific setting in time and place can be conducted a large extent through investigation of communicative interaction. And it becomes possible to investigate such interaction, as many do, through audio and video recording of naturally occurring activities. And importantly, they are examined for their informal logic, the logic that the members rely on in their work. Now we have set the premises for studies of knowing as practical activities and courses of interaction. I wish to start now with how we analytically can formulate a context where the dynamics of knowing and learning is at stake. This is important when it comes to criteria of relevance, that our studies are grounded in current issues, problems, and dilemmas. I will start with some entrance points that I have used, and I will then go on to exemplify how, across time and many projects, we have formulated areas, found areas and formulated problems to investigate. Knowing and learning is at stake in society when socio-technical innovations or social dilemmas become a matter of public concern. This is observable when experts, journalists, interest groups, politicians, and the general public begin to debate concerns publicly. Such debate is conducted in terms of identifying risks and opportunities and is characterized by many different voices and arguments from different positions in relation to that concern. We have used Bakhtin's notion of heteroglossia when concerns of stakeholders are formulated very differently as social, technical, economic, political, environmental, ethical issues. The debate will circle around what constitutes the heart of the matter, how it should be managed, and who is responsible. So, the activities, entitlements, obligations of institutional actors are anticipated in these debates, with many different stakeholders involved. Some institutional actors will become responsible to deal with such dilemmas and formulate ways of pursuing them through a set of activities. So now let's turn to some examples. Burnout. Burnout and various kinds of fatigue syndromes have long caused concern in the public debate. Thousands of studies of burnout in fields such as neurobiology, psychiatry, occupational medicine, psychology, even the history of ideas has been conducted, and over 130 symptoms and factors have been identified. At this time, the number of sick leaves in Sweden were rocketing and became a political concern as a productivity issue as well as a health issue. And so they had to take action. And as we had a government that was run by the Social Democrats, they largely placed the responsibility with work organizations. This was a problem identified as arising at work. And these parties, employers and labor unions, were engaged to come up with ways to manage the upcoming situation. This was a new dilemma for these actors at the time, and it was necessary for them to formulate the problem in ways that made it both actionable and reportable for all practical purposes, to use the formulation by Harold Garfinkel. In this study, we had audio-recorded conversations from labor union and employers' organizations discussing how to define and manage this new task within their organizations and make it fit into already established professional practice in accountable ways. This required extensive discursive work. The labor union came up with the rehabilitation meetings, and the employers' organizations came up with accounting for employee health, which is now discussed in terms of well-being at work. The next example is climate change. At this time, we saw a transformation of the media ecology and changes in public expectations of what skills and competencies were relevant for citizens. With easy internet access and information overflow, navigating different kinds of discourses and being able to discern different lines of argumentation were competencies seen as relevant in relation to social scientific issues like climate change. Learning about climate change in school was a demanding exercise for students, but also for teachers, since there were multiple and sometimes rivaling scientific discourses that were relevant. The learning arrangements set up to train these abilities could involve thematic organization of project work, which often required some reorganization of teachers' work, classroom debates enacting different stakeholders' arguments, and simulations of UN Framework Convention on Climate Change. We followed classroom activities under a number of years and could see how students became aware of the issues at stake, as they clearly were emotionally engaged when positioning themselves in relation to these concerns. And they were later on prompted also by learning arrangements like virtual labs and tools for carbon footprints, along with inquiry-based activities based on research data. With the advent of big data produced from people's everyday use of platforms and search engines, our problem formulation somewhat changed later on to what it means for students to engage with science in society in a world that relies heavily on digitized information. Representations of science was something stable and robust. As something stable and robust was increasingly hard for teachers to maintain when students had easy access to follow scientific controversies online. We introduced digital methods to teachers for students to use in navigating and mapping controversies online. They generated trace data through a web crawler and visualized that data corpus as networks, displaying the websites of actors as nodes and links as edges. Both softwares were chosen in collaboration with Mathieu Jacobi, an engineer working at Sciences Po at this time. And the software applications were semi-open for pedagogical purposes, displaying algorithms in action as they collected and processed the data. So while we co-designed this learning arrangement with teachers, we had clearly changed the premises of the classroom activities. Instead of the traditional normative framing of school, and also controlling the sources of information the students were engaging with, we instead encouraged the incorporation of large sets of unsorted data from different sites as the students searched the web. Besides more in-depth understanding among the students in how the web is set up as a platform and how search engines generate trace data, a core element of schooling and its learning arrangements was being challenged. The social scientific controversies had to, in a school context, be approached both as research in society and research in the making, with all the uncertainties and socio-political tensions that come with it. My last example now, demographic change. The health sector and its stakeholders raise the dilemma of demographic change. The proportion of the elderly and that of the working population was changing dramatically and emerged as a critical public concern. With the surge in chronic diseases and age-related conditions, healthcare systems were confronted with increased demand for long-term care. And in this case, a whole range of digital technologies have been and still are suggested, along with self-treatment regimes. Well, this problem was first formulated as a new relation that had to be established between the healthcare professional and patients. the implications of such changes are far more far-reaching. Treatments, measurements, data generation and entry, monitoring and reporting were largely relocated from the professionals at the hospital to people's homes. And these forms of telecare change both the nature and the division of tasks and responsibilities for professionals as well as patients. To bridge the gap between different locations, health organizations also had to adapt. Professionals, however, are still responsible for the care of patients who are treating themselves and producing data under local conditions which are largely unknown. Monitoring patients' health at a distance changes the whole ecology of institutional work, and new interdependencies and contingencies emerge as a result when professionals are accountable to read the signs of data and act on them. So, a recap. Burnout did not exist as an institutional task, and the professional organizations involved needed to constitute it in professionally accountable discourse and practice. This translation work required learning at the organizational level. Climate change, emerging conflicts in scientific framing were salient, and students were trained to manage them discursively in an attempt to broaden their understanding of scientific reasoning and science in society. Social scientific controversies, mapping controversies by learning to manage large amounts of auto-generated data, made visible normative expectations of critical information literacy in school and created awareness of technical bias. Demographic change, the self-management of chronic conditions by digital means and monitoring devices place the patient at the center stage of what is slowly turning into data-driven healthcare service development. As we look through these issues over time, they have had more implications for further developments than were visible at the time of their emergence. And this tendency now seems to increase in both proportion and pace. We need to approach current dynamics of change with an aim to study whether and how professional knowing is disrupted and what learning implies for those concerned. So I wish to give some glimpses, very small ones, into more recent projects that I'm still writing on. I would like you to see very different examples of ongoing digital transformation in very different institutional practices. So you will be introduced to different worlds of professional practice. So this is a project, part of the Corpus project, and the project leader is sitting here, Monica Nerland. It was funded by the Norwegian Research Council. And I'm using this as an example. I will not tell about the study because that's part of a PhD project of Christopher Sadosh at the University of Oslo. But I will draw on this case that we have been looking into. And the case is patient falls, to minimize suffering, to cut public spending, to secure workflows and prevent risks of further complications. So there was a co-design project where they had to decide how patient falls should be registered, reported, acted upon, and so on. So this co-design was arranged to incorporate professionals in designing an application for patient information sharing across different units in municipal healthcare. To invite professionals to co-design at an early stage and work bottom-up was an unusual choice for the large city involving the city districts, different care facilities, and work teams. The professionals' work experiences were considered in creating the premises for developing new forms of service delivery that could leverage the many opportunities that they foreseed. The issue in this case was how patient falls were to be registered, treated, reported, and followed up. At the surface, a very tangible and concrete task, one could think, but very soon the complexities involved emerge. Was the fall an accident? Was it a consequence of a too demanding home environment, a symptom of some underlying disease, a consequence of new medical treatment? A category functional for the social organization of work need to be, as I said, recognizable, actionable, and reportable for all practical purposes. Entitlements and obligations of different professionals need to be differently tied to it, from the home care worker pursuing a registration task at the first instance of a fall, via the different professionals' actions on the fall, the GP, the radiologist, the rehabilitation team, and so on. To generating data, which is possible to follow up and analyze to prevent future risks of falls and hospitalization. These discussions display the complexity of this need for multifunctionality and extended use of patient information across time and local settings. And I will just show you then a comment made in one of these meetings by the project leader. This is really a very good input because we are constantly encountering that. How are we going to be able to identify which employees will follow this up? In addition, and as you say, one thing is that we are not able to do that within the system, but another thing is that the specific role varies. Moreover, the system is unable to guess. Information sharing implies knowing how to proceed with a case, and this is still salient to any professional group, where they are accountably involved with their patients. So negotiations of the meaning and use of the category in the system by colleagues across different sites are necessary elements when these practices are redesigned. Working with categories as object of design involved processes of testing candidate categories against different contexts of use, but also to make them intelligible, actionable, and reportable for all practical purposes, with many stakeholders involved. This kind of work will expand learning for many of the professionals involved in terms of systems thinking and ways to pre-configuring future forms of work. My next example. So this is a project, it's a small test that I followed. It's a case of bringing AI assistance in decision-making in radiology practices. So in the public debate, both hopes and concerns are raised when it comes to the consequences of bringing AI into professional fields like radiology, and especially the use of deep learning algorithms have been problematized in terms of lack of transparency, risk of bias, but also in terms of replacing professional radiologists. And in our project, the notion of professional trust in this system was the main entry point. I should say that the main project here is the title is Professional Trust and Autonomous Systems. It was funded by Marianne Marcus Wallenberg Foundation in Sweden, and Jonas Ivarsson is the PI and main applicant of that. So in the use of AI was being tested and researched at Sahlgrenska University Hospital to determine its clinical effectiveness when assisting radiologists in fracture detection. The AI that was being tested is the company ASMED's fracture detection program, RayValve. ASMED received its FDA approval for the program in 2021. And the RayValve algorithm is developed on the basis of deep learning, or more specifically, convolutional neural networks. So I will give you a glimpse now of this practice. So the idea of testing this project was initiated by the radiologists themselves, working together to be ahead of development. I came into the project late 2022, when they had just received a contract with a company to test RayValve for a 6-month period. Physical and social arrangements made to test the product were made to test the product in many respects. They created a test bed where the images could be sent for analysis and received, and then compared with the radiologist's professional judgment. On many types of patient cases, admitted at different times, with different types of fractures, and there were also plans to compare this AI product with another one. Their first study was retrospective, and the second, they would go live. That meant that they would still follow the ordinary clinical procedure in parallel with the AI assistant. So they prepared a lot. They communicated and prepared the staff. There were preparations for informed consent with patients, that they were not being treated differently. They had their clinical procedure as usual, but there was a parallel process that also would use their images. The first patient to go live, they named Adam. And I will just read this excerpt because I understand you can't see it. So these are my ethnographic notes. Monica starts to brief us that they have had a couple of cases. Monica starts to brief us that they had a couple of cases she selected, and John moved them to Orthanc, which is the test place. He didn't have time to do all cases on the list, but last week he took the rest, and Monica worked with them too. There are a couple of weak sides to this AI, and they are discovering them. Nick shows up. Monica says that what was most exciting was that she saw a case in AGFA, and that is their ordinary work environment. So it was wonderful to open AGFA and see a case that was processed, investigated, she said, by AI, and that is what has happened, a pretty large step forward, she says. Nick shows the case. He opens AGFA and the case named Adam, and he shows an image of a hip. The question is displayed: is there a fracture? And the last image produced no suspicion of fracture. And we agree, they burst out, and they all laugh. Testing new technology is an established practice for radiologists, who historically have had to reclaim their expertise and positions with major technology shifts. There were, of course, new elements to this technology, but largely they relied on established practices. There was, you could say, a system preparedness in this case. Now, my last example. So this is project which was funded by Nordforsk, and it's called Infrastructures for the Partially Digital Citizens, supporting informal welfare work in the digitized state. And here we are 3 KPIs. It's Britt Ross-Winterreik, who was the main applicant, Margit Hanestad, and myself. So in this project, at the time of this project, a number of concerns were raised and reported through the media, and there were people who were largely left behind and having increasing difficulties as the public sectors were turning to digital solutions. This was becoming salient as access to healthcare portals, school platforms, and social services increasingly required EIDs and mobile connectivity. Denmark had just implemented a digital by default policy, which made such consequences very visible. So there is a digital inclusion issue that re-emerges in the digitized state. The Scandinavian countries had been forerunners in digitalizing the public sector services, and we saw this as a test ground to discover unintended consequences. So we did some observations across these three sectors. It was the social sector, it was healthcare, and it was education. And we targeted professionals working at the front line, meeting people. And the aim with this project then was to map informal digital support work and discuss design requirements for an inclusive digitized welfare state. So we were interested in approaching the professionals at the street level, social workers, teachers, and nurses. Now, when it comes to school platforms have been largely introduced to facilitate school-home communication. And this was an area with little research done at the time, so we decided to look closer into it through interviews and later through a survey. These are two typical written accounts from open-ended survey questions of what kind of informal support teachers were providing. And this is then providing both in preschool and school for families. They need help with digital platforms, how to get a login, how to make the system work on their mobiles. We must explain the system to them. And this is a language problem. They are not familiar with the technology. I also give them all important information orally and on paper with clear short text and pictures that I personally show and hand over. Our data across sectors displayed such gaps between the situations of actual people and the intended users of the systems. The professionals were in many cases their link, not only to school, but also to other important actors as well. Policymakers and system designers have largely relied on the established notion of a competent technology user, logging into portals with their EIDs and navigating available services. This conception relied on statistics of the everyday use of digital technologies in the Nordic populations. The idea of a competent technology user and even universal design as a standard to make systems available for predefined categories of groups with special needs do not really meet the requirements and responsibilities of the Nordic welfare states. The user is not a stable entity. What this project has shown is that this narrow idea built into the design of the digitized state has had exclusionary effects that were not anticipated by policymakers and government authorities. So the gaze must be turned to how a welfare service system can be achieved and maintained, and this requires learning how systems and people are complementary and interdependent. So we could see policymakers, government authorities, and system designers were facing emerging matters of concern, where the systems which made services more available for a majority may never be able to close that gap of digital exclusion, which in turn implies that welfare would not be for all. The consequences concerns the displacement of institutional accountability, something which was carried by the informal work performed by people in the local settings. We are becoming increasingly aware of the far-reaching consequences of digital transformation. The way it changes the communicative infrastructure, the intermediary function of institutional practices have, in a sense, become invisible to policymakers and managers of public sector services. What we have seen in our projects are very different instances of professional work in digital transformation. And this really requires us, as researchers, to adapt our analytical gaze and tailor our conceptual tools so they are sensitized to the situated practices of knowing and learning. And some collected insights aside from this, I think that learning conceptualized as bridging a gap between action and expectation can be applied at several levels of granularity. Negotiating boundaries and responsibilities are also key when emerging issues need to be transformed into practical action. And digital transformation, on the other hand, has many sides, but the implications for knowing and learning are still embedded in local institutional conditions. Now to my last, I hope, slide, where I bring up some conceptual analytical tools that I think are useful if you're interested in this kind of work. And multi-layeredness is also something that we will discuss later in the symposium. Monica will present part of that. I think that the multi-layeredness concept speaks to the corpus kind of co-design work where professionals are engaged in designing, and their implications for learning are really interesting to explore. And Batista argued that workplace technologies generate both service and deeper effects on what they refer to as patterns of work and structure of organizations. They are not multi-layered, but constitute effects of effects, which may have disruptive consequences. Their interdependencies arise from the co-evolution of these technologies as they are built into the social fabric of organizations. They refer to first, second, and third order effects, and you can read more into that. Then the logic of disruption and logic of continuation we can use as an analytical tool for several of these cases. I think the logic of continuation in the AI case was interesting. Now, Torenholt and Langstrup also say that in both popular and academic discussions of the use of algorithms in clinical practice, narratives often draw on the decisive potentialities of algorithms and come with the belief that algorithms will substantially transform healthcare. We suggest that this approach is associated with the logic of disruption. However, we argue that in clinical practice, alongside this logic, another and less recognized logic exists, namely that of continuation, where the use of algorithms constitutes parts of an established practice. And the last notion, an analytical resource that I have found is Orlikovsky's and Scott's paper on digital undertow and institutional displacement, where they say that in the debate, considerations of direct digital displacement, like displacement of jobs, are critically important, of course, to follow, but there are also institutional displacement, and these are processes of digitalization that are unwittingly undermining core institutional values, norms, and rules, which over time are reconfiguring how organizations perform. So, thank you to those involved. I have not had the possibility to mention everyone, but this is the end of my talk, so I welcome questions. Thank you.
Tusen tack. Okay, we're open for questions, and we've got a microphone and an energetic runner here. So has anybody got, thank you very much, first of all, but questions that you, or comments, or thoughts, or reflections that you'd like to share with Åsa? And don't be shy.
Yes.
Thank you.
Also, thank you for a very insightful keynote. I learn something from you every time I hear you speak. I wanted to ask a little bit more detail about how you connect some of the ideas that you've explained here, where, you know, hidden issues become visible, and how can you really connect that with the organizations themselves so that they can bring about positive change? Could you give us some more insight into that?
Can you formulate that again, please, Alison?
Well, the insights that you had, for example, where people were excluded from for example, the school platform.
Yeah.
How do you practically use these insights to work with schools or organizations to help bring about change that helps the people who are excluded?
I think that in many schools, these platforms work, to say that first. But it depends, of course, how families that are engaging with schools, what kind of resources they have, what kind of connectivity, what kind of language resources they have, because these platforms are also in Swedish. And of course, only that creates huge amounts of problems, and that's a fairly easy thing to redesign. Also, the interface of the school platforms is not the same for the teachers as they are for the families. So to guide them is also an issue that could be easily maybe managed. But I think the gaze should be turned to the designers, and the realization that they really need to co-design these platforms. They need to be able to bring in people's different kinds of situations. They need to realize that these systems do not work independently, and maybe not these families or these patients do not work independently either. So you can use the support system around people, and you can have more of co-participation and more of co-design to figure this out. But I do think that there will always be a need for a human element, because, you know, people change over the course of time, and their cognitive abilities change, and so on. So people are not stable entities. It's hard to design for everyone, but that's the way it goes.
Thank you.
More questions, please? Over here. We'll come to you afterwards.
Thank you for a very interesting talk. I really enjoyed that. My question is about, at the beginning of your talk, you obviously gave the very nice example of the fractured femur person. And what is obvious in that example is that a certain kind of knowledge of the patient is produced. So the patient is positioned in a particular way. And through that process, also something about who or what a human is gets erased or obscured. Right? And so when you started talking about the digital and the ways in which the digital also starts to produce certain kinds of knowledge and certain kinds of moral obligations, I was likewise thinking about what gets erased or obscured in this particular process. And when we talk about digital inclusion, especially in terms of schooling or in healthcare systems, how does digital inclusion, I have actually two questions. What gets obscured or erased there as well? What happens to the affective dimension between, say, teacher and student, or teacher and parent, or the medical practitioner and the patient? And what about people who do not want to be digitally included? We recently had a case in the Netherlands, I'm from the Netherlands, where, for instance, the issue of surveillance and hacking also was a problem, because about a couple 100,000 patient dossiers got hacked by a government, from a government medical institution, and are now, you know, on the streets, basically, all this medical information. So the concern of some people might also be surveillance and hacking, and people may want to opt out of digital inclusion, depending on their personal situation. So I was wondering what you think about these things?
Yes, thank you. In that case, in that project, we were active in 3 different countries with 3 different kinds of policies. The Denmark policy was digital by default, while in Sweden you have the right to be non-digital as a citizen. So, but still there were, of course, huge problems because these platforms do not adapt to that right of the citizen. So there is a gap there, and that certainly needs to be addressed. I also think that it's interesting that this is such a blind area, you could say, that policymakers and managers of public service sector organizations tend to think that an interface could replace the intermediary functions of an institution. I think that is really fascinating. So, yeah, I don't know if that was an answer to your question.
Yeah, and especially, the sort of what happens to this interhuman relationship, or the affective dimension, the intermediary that was maybe institutional or human, or a couple of humans at some point, and now becomes a system, a digital system, or an algorithm. Or
And in terms of learning, I also think that this is very important because people do not learn from a portal. So how do you navigate public services? If you're new in a country, if you're growing up, and if you're not already aware of how they function and work, you need to be able as a citizen to take the institutional perspective on your case. And that was earlier sort of elaborated in the face-to-face encounter between the representatives of these institutions and the persons visiting them.
That's great. Thank you very much.
We had a lady over here. Any question?
Yeah.
Does someone would like to ask a question after? We've got that hand up, or
Well, thank you, Åsa, for your talk. That was very interesting. My name is Marit Hovheid. I'm from Norway, NTNU. I have a question more conceptual in relation to your concept of knowledge and knowing. Gilbert Ryle made a distinction between knowing how, or knowing that, and knowing how. When I listen through your talk, I hear what I hear, and I might be mistaken, but I hear a lot of reference to knowing that. And we know that is when you talk about the situatedness, we are into knowing how, and that's not the same, and it's difficult to get there. When you refer at the end, you refer to the analytical conceptual tools that you suggest. You're basically on a systems level, as far as I can see. You talk in system theoretical perspectives. So again, I don't really grasp, and this is where I'd like you to elaborate, if possible, a little bit around what is meant with situatedness here. Because it's hard to really see. I can't see any embodiment of knowing and learning, which is very deep, as far as I can understand, into knowing how.
Well, it wouldn't be possible to go into that with all these examples. So it's a choice I made, of course. But in all these cases, you can get into the interactions and the situatedness where students, where professionals are using what is already established, what is known to them in interaction and in activities where there is some task to pursue. So I think that the distinction between knowing that and how is not something that I work with. I think that knowing how to proceed includes both, and that is what I study. So I study that in you could say, in the process. The other question was the tool concept and how that can be used at the systems level. I don't think it can be used at the systems level I think that we need other types of analytical notions, like the last three that I mentioned. The multi-layeredness has tool components in them. When pursuing a task, you use a tool, and that tool can also become the environment. There is a dynamic also in tool use, but I think that with these environments, not only the tool is digitalized, the activity system is digitalized, and even the welfare state is being digitalized. So we need to have more broad concepts, and this is why I brought this along. I hope you can read into them if you're interested, but thank you so much for your question.
Okay, some more questions? We've got a question here. You might be able to just say it and then we can relay it on the speaker before she gets down.
Yes, yes, yes. So the question was, I mentioned that learning is the locus of cultural change in this perspective. It's simply because when we look at these situations, these during digital transformation, nothing would work if people were not learning and adapting and continuing, maintaining and developing the activities that they are engaging in new situations. So that is the kind of learning that is emerging when there is a new system, when you are supposed to learn how to navigate a web portal, when the nurse needs to close the gap of understanding, the signs from data on how to act on them. This is something that requires learning, and it's also something that is necessary for the digital transformation to develop. It could go in a bad or a good direction. Learning goes in both directions. So that's really where it happens, and that was my argument. So thank you for asking.
Other questions? No, sure. We've got questions. We've got a willing microphone runner here to take questions. No? Oh yes, thank you.
Okay. Morning.
Yes, thank you, Åsa, for this inspiring talk. I was thinking about your title, Ways with Words. And I was thinking, when you provide the examples, the role of the words in the worlds. Are we, as analytical people or researchers, are we facing a time where the words become equally important, or do we need other, the technologies are here, the materiality are here, numbers show up in the data-driven world. So how do you look at the significance of words in relation to other representations?
Well, my position is a bit different than the premises of your question, because to me language is a technology. It's produced by us. It has certain consequences. It's also a programming language. There is a material and social side to both what we use with words and what we act with in worlds. So this is, I don't like the distinction to begin with, so that's my response.
Do you want to come back at all?
No? You want to?
Okay, any other queries? thanking, I don't know if I need a microphone. I don't know, is it on? Yeah. By thanking Åsa for her keynote today and for raising all sorts of thoughts and questions and queries that I'm sure we're all going to go away and think more about. And I love the title because as a language researcher and someone who's looked at language, I've always been talking about reading the word and reading the world. So that sort of connection between words and worlds is really, really important, I think. So thank you very much. Here's a little gift from the team.